All right, well, let's go ahead and get started. We'll introduce myself. I've introduced myself a little bit in the chat, but for those of you who just joined, my name is Nicole Shaneborn, and I am a mental health first aid instructor and the evaluator for the Southwest Prevention Technology Transfer Center. It's a mouthful. It's also known as the PPTC, as some of you may be hearing about that. We are fairly new, so it's kind of a new acronym to get used to. And a fun fact about me is that I have 8 kids, 3 chickens, and 2 very pampered dogs. So we have a house full, but it's fun. And I will turn it over to Wanda to introduce herself.
Good morning. This is Wanda West. Thank you for joining us. And I am also a mental health first aid instructor of the adult course. And I'm the instructional designer for the Southwest Prevention Technology Transfer Center. And I'm glad to be here with you. My fun fact was that I listed in the chat was that my son is a professional longboarder. So if you look up James West longboarder on YouTube, you'll see a bunch of his videos. So that's more of a fun fact about my son. But I'm his mom, so it counts, right?
Definitely.
Thank you. Thank you for validating me, Nicole. And I'm going to get us started here on our presentation this morning. So as you heard, we are with the PTTC, the Southwest. And so we wanted to give you a back to talking about the PPTC Network. This map kind of gives you an idea of what that looks like geographically. We are the Southwest, which is in the purple. So that covers New Mexico, Texas, Oklahoma, excuse me, Louisiana, and Arkansas. So those are the states that are covered within the Southwest. We put our the website to the PPTC Network down here at the bottom of this slide, and we'll show that again at the end of the webinar. And this is a live link, so at some point today, even later on when we get down to the end of the slides, and I'll encourage you to navigate to that and look at our website for additional training and some more information about the PTTC. So what the PTTCs are tasked with, this was the former CAPT, and so their job is to improve the implementation and the delivery of effective substance abuse prevention interventions and provide that technical assistance and training to the substance abuse prevention field. So that's basically the task. And so, if you're interested in more training and events, be sure to, and resources, be sure to go to that website sometime. So here's our roadmap for today. We're going to cover 3 things, and it is going to take the whole time. We are starting out with just kind of an overview of mental health first aid. We see that about half of you have taken a mental health first aid course in the past. So we want to just kind of give you an overview of that and tell you what it's all about. Maybe you're here because you want to learn more about that. Maybe you are involved with mental health first aid and want to learn more about how that ties to prevention. And Nicole is going to do a really fabulous job later on of explaining that to you. And then lastly, we'll talk about what are some things that you can do in your community to bring this amazing program to your community and to support the interventions and support the individuals and organizations in your community. So that is kind of our layout, our roadmap, and that's what we'll be covering. So hopefully that's the webinar that you signed up for. And welcome to those of you who just joined us. It looks like Julie introduced herself, and she's here from Oklahoma, so welcome. I might mention that Nicole and I are both in Oklahoma today, so.
We are.
Yes. We have beautiful weather today. I just moved
Finally.
here from New Mexico, so the humidity is different for me, but I think I'm going to be all right. I haven't melted yet. so so here we go. We're going to just jump right into mental health first aid and talk about the action plan. And some of you have taken the mental health first aid, so you know what that action plan is. How many of you, just by a raise of hands, to test that out, have taken a physical first aid class?
Looks like we have quite a few, Wanda.
Okay, that's awesome. I think I was in high school when I took mine, and that still counts. So you can raise your hand if you were in high school. We are not going to test you too bad. So those of you who raised your hand, hopefully there are some of you who have taken it recently. We learn in physical first aid that there is a memory aid that is CAB. Does anybody, you can write this in the chat box. What does CAB stand for? It was formerly ABC. Nicole, you can't type. Oh, okay. What is your?
I was typing the question.
All right, I thought you were going to type the answer. Does anybody know what CAB stands for? Even if you know what one of the letters stands for. So everybody else took it when they were 16, like me. Oh, Garcia might know some of them. Let's see. Circulating airway and breathing. Thank you for taking a stab at it. Anybody else? Compression. Yep. Compression, airway, and breathing. Thank you guys for attempting that. So it's compression, airway, and breathing. So in mental health first aid, we also sort of have that memory aid, and that memory aid is algae, which is not quite as easy as CAB, but it does help you to remember those steps. So let's walk through the steps a little bit, and as we do, I want you to look at each one of those steps and what's involved, and think about what are some things that stand out to you? How is that different than something you've seen, or how does that sort of resonate with you in terms of being able to work with someone who may be having a mental health crisis, or who might have something that is developing. So think about that. Think about maybe even how that might apply to you or your community. So the first one, A, is for assess for risk of suicide or harm. And that's kind of similar to physical first aid. First, you want to make sure that there isn't any harm to you or the other individual. The L stands for listen non-judgmentally. The G, give reassurance and information. The E is encourage appropriate professional help. And the other E is encourage self-help and other support strategies. So the purpose of today is not to, go into these at length or anything, just to kind of introduce you to them and tell you what they are. That is covered more in the mental health first aid. And what we want to do is encourage you to take a mental health first aid class so that you can put those into practice and really learn them. So what are some of your impressions, or what might be some of your questions about the action plan? I'll give you just a minute. Okay, so hearing no questions, Nicole, did you have anything you wanted to bring up?
Oh, no, I was just going to say that you're welcome to type those questions in the chat as well, or open up your line and ask the questions too.
Right. Yes, thank you.
You're welcome.
Okay, so they're pretty straightforward. So let's move on, and we'll talk a little bit more about those. So as I go through each one of the different parts of the curriculum, just keep in mind that this ALGAE action plan is practiced throughout with each one of those different mental health disorders. So, all right. So when you go through a mental health first aid training, Nicole and I are trained in the adult mental health first aid, and this summer we will be trained in the youth version of mental health first aid, and the youth version is for anyone who is who teaches or works with youth. So it's that's the training of trainers. So, and then you will be training individuals who work with youth. There are a couple of other different versions of that and supplements that go with the mental health first aid. One of them is a higher education, and Nicole is trained in the higher education mental health first aid. So those are for individuals working in the higher education field. The other two that deal with traumatic situations, possible traumatic, is for military veterans and their families. So, and I have been trained in that version. And then there is also an EMS and fire version. So as you can see, there are lots of different supplements out there. We also have the opioid supplement right now, which will be included in the new materials that are coming out very soon. So in this section, this is the first part of the day. Oops, not yet. 1 second. Sorry, Elizabeth. I'm talking a little more than normal. So I wanted to just bring out that the first part of the day and the first 4 hours of the training, you'll be learning about developing mental health problems. So things such as depression, anxiety disorders, psychosis, substance use disorders, and eating disorders. Eating disorders is covered in your participant manual, but it is not part of the presentation. That has been cut out a little bit to make space for. You'll see that when you take this training, it's very interactive, and there is a lot of content to cover and a lot of practice that takes place. So the information is there, it just may not be presented on. So when you discuss each one of these areas, the curriculum defines the disorder. It shows you what the signs and symptoms are. There will be activities with each one of those, like I said. You'll talk about the risk factors. And then, of course, you're going to work that ALGAE action plan for each one of them over and over and over again so that you can become really familiar and really comfortable using the ALGAE action plan. And then, of course, as you saw in that ALGAE action plan, that one of the things that you do is provide resources. And so in the curriculum, you are given a lot of different resources for each one of these mental health problems, so that kind of gives you a good start to knowing, what you can suggest and recommend. Okay, so we have duplicated one of the activities. This is where we're going to go back to that other layout, Elizabeth. Thank you. So we've duplicated one of these activities from the manual. Of course, this won't look like this when you take a face-to-face training. But what we'd like to ask you to do here is one of the activities involves listening to some various scenarios in the groups and then determining what are some helpful and unhelpful things to say to someone experiencing depressive or anxiety symptoms. So we're talking about depressive or anxiety symptoms here. So what you'll do here is just click on the button, whether it's helpful or unhelpful, to say these different phrases. Looks like we've had a few people answer. We've got several people on the call today, so we should be seeing more than just 12.
Yeah, and you guys can just click on those little dots underneath each question. Don't be shy about doing that. Sometimes I know with all the boxes it it looks a little scary, but it's really not. You can just click on the dot with your answer right below the question. Like we've got a few more, Wanda.
Yes. So, okay, I'm going to broadcast the results here so everyone can see. So the first one is, I had an aunt once who experienced exactly the same thing, and it was the worst time of her life. So I know how you feel. So it looks like most of you responded unhelpful, and one of you responded helpful. And I can see how that would be a little bit confusing. So where you want to seem to be empathetic, you don't want to seem too judgmental, and act like you know exactly what they're going through. So it looks like unhelpful is the correct answer here, and most of you got that correct. The next one is something bothering you. So most of you responded correctly with helpful. So that is helpful. It's just opening up that conversation so that they can. The next one is pull yourself together, and thankfully everyone responded unhelpful, because that is not helpful. Pull yourself together, although that may be like a knee-jerk reaction, but it's definitely not helpful. Have you spoken to anyone about this before is the next one, and all of you responded with helpful again. So yes, and so that is, again, just opening up that conversation. The next one is, let's go have a cup of tea. And most of you responded that that's helpful. Again, that is just making yourself available so that that individual feels comfortable opening up to you and feels like you're making your time available to them. And then the last one is it hard? It is hard for me to understand exactly what you were going through, but I can see that it's distressing you. So again, it's just recognizing that individual is going through a hard time and being empathetic to the situation and their circumstances.
Wanda, I was going to point out, too, that the question, have you spoken to anyone about this before, that also can give you guys an idea if you're talking to someone, if maybe they've been in treatment for a mental health issue before, or if they've talked to someone. So that's a good clue, which we'll see later, for a mental health first aider to know.
Yeah, thank you for bringing that up.
No problem.
Because when you get to that LG step where you provide resources, that may be a place where you recommend that they go back to if they have sought treatment for that before. Okay, so going back to the presentation, we're going to talk about the second half of the day. Thank you all for participating in that activity. So that's just an example of something you might experience of when you take a mental health first aid class. So the second half of the day is very interactive. This is first aid for a mental health crisis. So someone who is experiencing an actual crisis. And for those of us not in the mental health treatment field, that can be a little intimidating and even a little bit scary to know how to handle that situation, because we don't want to cause any more harm. We don't know you know, what to do in a lot of cases. So in the afternoon, you'll experience a lot of videos and hands-on, and again, you'll be practicing the algae. One of the things that with the new curriculum with the opioid version is that you're going to learn how to administer naloxone in the event of an opioid overdose. We do want to mention, though, that this does not take the place of that certification. It is just to kind of show you how that would look. So you get up and you move around and you practice and you do, and you learn so much about each one of these different situations and how you can be of assistance in those situations. So up to this point, that's kind of talking about the overview. Are there any questions that anyone has? Feel free to get on the phone or ask your questions in the chat. Just as we've talked about the curriculum, have there been any questions in your mind?
All right. I'm not seeing any in the chat, but if you guys have questions as we talk through today, feel free to post questions in the chat, and you can even use the little icon to raise your hand or open up your line.
Thank you, Nicole. Okay. So how does mental health first aid help? So this is kind of the question we want to be able to answer for ourselves and for our communities. Why this? And you know, what does it do, and how does it actually help? So, you know, just kind of going through these things here on the slide. The most important is preserving life. One of the aims of mental health first aid is to preserve a life when a person may be in danger to themselves or to someone else. So that's, I think, the most important benefit. The next one is individuals who don't have a background in behavioral health can still help. So we talked about that, you know, a couple of times already. Someone like me who does not have a background in behavioral health, I still feel like there are things that I can do to help someone. And it sort of takes away that fear of doing something, which also reduces the stigma. So, you know, one of the things that we've talked about in mental health first aid, and I hear Nicole say this a lot, is that, you know, sometimes people feel like if they help someone, especially someone in crisis, that someone may be dangerous to them or harmful, and so there's a fear around that. So mental health first aid kind of helps with that and helps to reduce that fear. And then lastly is to promote and enhance recovery. So again, we saw the algae action steps, and one of those was to encourage self-help and encourage resources. So you encourage those individuals to get recovery and treatment and be healthy. Any questions about that? So in the chat box, we have a question for you. Can you think of other ways in which mental health first aid would be beneficial? So already you may be thinking about yourself, some individuals that you may know that have some of these mental health struggles. And so as you're thinking about that, how does that sound beneficial to you, either in your personal situation or your professional situation? So we have several people typing, so we're going to just wait a minute and hang out.
That's great. Thank you guys for sharing.
Yeah.
And Michelle says, keep the person in crisis stable until a professional is available. Very good. kind of provides that bridge and support. And then Tony says it does start a conversation, which I guess would reduce stigma. Yeah, it helps open up the conversation and provides a safe place for someone to talk about that and get them help and resources if needed.
You know, it's kind of like what we were talking about earlier, is that person doesn't feel so isolated that way. You know, feel like, you know, they're the only ones going through that type of a situation.
And the more people we have trained, you know, the more a neighbor can assist in a situation like that, a family member, a caregiver, and so it really surrounds the person with a lot of support.
So Tony is saying that he works on a college campus, and the housing department RAs take mental health first aid, which is awesome. That's wonderful. And to ensure that they can support the students in need and perhaps who need a referral, and also reduce stigma and safe places to seek help. We want to create a culture of safety and support for all our campus. Thank you for sharing that, how that's been used on a college campus. That's very helpful. Some of you may be working on college campuses or near college campuses. Shelley encourages community engagement. Yes. Yes, definitely.
Violetta says something similar, that it ensures communication stays open with the individuals, particularly the family, within the individuals, particularly the family. Very good.
I think, you know, that's a really good point, that that communication, you know, and just being open, just starting to talk about it and being open with one another. That helps to reduce the stigma as well. Tanya says, I work alongside teen court and with at-risk youth. I think this will help with identifying issues to help keep the youth out of the juvenile system. Yes, and, you know, I definitely encourage you to take the youth mental health first aid, and we'll show you how to sign up for a course later on in the webinar. Thank you all for sharing your ideas. That's really helpful, and hopefully, you know, as you think of things, go ahead and put them in the chat box, because you may be helping someone else in their own community, thinking of things that they can do. Okay, so thank you for that. And we've covered the overview. And so continuing with our roadmap, I'm going to turn the time over to Nicole, and she's going to talk about that connection to prevention. So those of you who are on the call who work in prevention, you're going to find this fascinating, because we as preventionists may or may not be trained in mental health treatment. So having this connection and knowing how we can bring this to our community on a prevention level is going to be really helpful. Okay, Nicole, take it away.
All right. Thanks, Wanda. All right. So I first want to introduce you all to the koala you see to the left. And we heard that acronym earlier, ALGIE, for our action plan. This is Algie the koala. And Algie is the mascot for Mental Health First Aid, and we often take him along with us to do our training. So as my husband informs me, koalas are not bears, but this is Algie the koala, not koala bear. So that's a nice introduction to Algie. And then Algie is going to talk to you all today about how this is related to prevention. So by a show of hands, and you guys can use the hand icon up there at the top, how many of you are familiar with the levels of prevention? We just want to get an idea, because sometimes we may not all work in prevention that are on the webinar, and so it just kind of gives me an idea of your experience with that. So far about half of you, it looks like. All right. Very good. All right, so we'll do a quick review here with some examples if some of you aren't familiar with the levels of prevention. Or it may have been a while since you had a SAPS too, and that's totally all right. So with our universal prevention strategies, these are the ones that are directed. You notice how it's the larger part of the triangle there. These are the ones that are directed at our population as a whole that may or may not be at risk for substance use or mental health issues. And so these are our large sort of education trainings that aren't based on risk. And as that relates to mental health first aid, this would be going out and doing mental health first aid training regardless of risk to folks in the public. So that's a way that mental health first aid addresses prevention at the universal level. And then with selective, these are individuals who may be at risk, but in terms of substance use, because I know that's easier for us to think about, they may not be using yet. And so this group may be people that have family members that have a history of substance use. They may be in the criminal justice system, things like that. And so this would be an example with our mental health first aid where we do specific modules for those that may be at higher risk. So our veterans, fire EMS, and maybe if we did, a caregiver training for family members that have a history of substance use disorder. So those are some examples of how the mental health first aid could be used in a selective way. And then for indicated, these are individuals who have a developing mental health issue or substance use issue, but may not be diagnosed yet. And so this is really where our actual intervention delivery happens with mental health first aid, because we would be delivering the mental health first aid intervention to those who have a developing mental health issue or may be in crisis. And so that's an example of how that all relates to the levels of prevention in terms of mental health first aid. So I want to make sure you all are okay with that, because I know sometimes that's a little confusing. So does anyone have any questions about that? You can type it in the chat or raise your hand. Just want to check in with you to make sure. Right? So far, no one typing, no raised hands, so you guys are good with it. That means you either are asleep or I did a good job explaining that. So I will go ahead and move on.
I'm awake, Nicole.
All right, awesome. All right, so let's move on to talking about the Continuum of Care, which I know most of you are probably familiar with this, but let's go ahead and check in on this too. So if you'll use your raise hand icon. I just want to see how many of you are familiar with this, have seen it before. Got a few of you. Awesome. Great. Yeah, so again, about half of you. And so the Continuum of Care is, as you can see, we've got all of our different spans of interventions across the continuum, all the way from promotion to treatment and recovery. And then promotion happens at all aspects of the continuum of care. And so we want to continue that promotion no matter if someone's in recovery or they're getting a universal prevention strategy. So one of the ways we can sort of see where you really feel comfortable here is we're going to pull up a poll, and Elizabeth is going to pull that up for me now. And in the first box, we're going to talk about where you work most in your career in terms of the continuum of care. And then in the second box, you're going to mark where you feel most comfortable. And sometimes this is different. So I currently probably spend most of my time working in universal prevention strategies because I do a lot of training. But in terms of where I feel most comfortable, I spent a majority of my career dealing with the indicated level of prevention, working in HIV and people with that were already starting to use. So that's just an example of how that can be different. You may work currently in a certain level of prevention, or you may work in treatment, but you may feel more comfortable in another area. So let's see how we're doing here. We've got, looks like most people, about 60% so far, are working in universal prevention, some in promotion, and then one or two working with selective and indicated. And then in terms of comfort level, most of you, it looks like, feel comfortable with universal prevention strategies, right? Because that's where we spend a lot of our time in prevention usually. And then some of you selective and some promotion. And we have one person that feels the most comfortable in treatment. Great. So it looks like we've got a good spread of comfort level here. That's awesome. Well, thank you guys for completing that. That just helps us get an idea of who we have in the audience and where your comfort level is. So let me talk about the continuum of care a bit more, since we have some of you that may not have as much experience with that. So the continuum of care was presented by the Institute of Medicine in 1994 as the mental health intervention spectrum, and then it was expanded in 2009 to include promotion, and that's what you see at the bottom, and then you see its own segment there. And then the continuum of care describes the scope of behavioral health services for individuals really before, during, and after they experience a behavioral health problem or disorder. And it includes promotion, prevention, treatment, and maintenance. And then it segments the need for care and the types of care over in the treatment area required from various parts of the healthcare system. And this is really important as we talk about mental health first aid, because it really does take a village, so to speak. It takes the whole behavioral health care spectrum and prevention spectrum to address mental health first aid. And then the continuum underscores the interrelationship among promotion, prevention, treatment, and maintenance. Well, some of these services may be more specific and individualized. Some may be more costly. It does show that each phase along the continuum does not exist in isolation. That's a really important point to make in terms of mental health first aid. We need everyone to participate in helping individuals with developing mental health issues. So let's move on and talk a little bit about risk and protective factors now. And some of you are probably familiar with that term, but let's just test your knowledge here. Over in the chat, I'm going to ask you, what does a risk factor do? And Elizabeth is posting that question. And then also, what does a protective factor do? And these are both important to prevention as well as important when we talk about mental health first aid. Multiple people are typing. I love it. Okay, Violetta says risk factors increase chances that somebody will engage in dangerous behaviors or substance use. Very good, Violetta. So as we increase our risk, the chance of substance use and mental health issues goes up. And what about protective factors? Anyone want to take a guess at that? Got several people typing. I am hearing someone doesn't have their phone muted, so just make sure that you've got your phone muted by pressing *#. Right. Violetta is typing. So our protective factors are going to do sort of the opposite of the risk factors, right? They're going to decrease our chance of someone having a substance use or behavioral health issue. There's Violetta's answer. Awesome. Protective factors such as family and peer bonding, school engagement decrease the chance of risk behaviors. Very good. So there's several factors that have been found to decrease that risk, and the more protective factors we have, and that can be a cumulative effect to help decrease that risk. Very good. And then we also have something called shared risk and protective factors. And those have been found to influence both substance abuse and mental health outcomes. So our prevention efforts that address those shared factors are more likely to have a greater impact, as these factors have the potential to improve multiple outcomes. The shared factors can also serve as a point of change for those cross-sector partnerships between substance abuse and mental health disorder prevention fields. So this really relates a lot to our mental health first aid, in where we're dealing with substance use and mental health issues that are developing, and showing how everyone can work together to form a comprehensive approach to address those shared risk and protective factors. And then the term behavioral health, if you recall, refers to a state of mental, emotional being and or choices and actions that affect wellness. And our behavioral health problems can include substance abuse or misuse, alcohol and drug addiction, serious psychological distress, suicide, and mental and substance use disorders. And so all of these can be affected by us participating in mental health first aid and joining forces together. During the curriculum, it does highlight several risk factors by disorder, including substance use disorder. There's a lot of videos, a lot of scenarios, and they've all really sort of come up with a theme of connectedness, as we were talking about those protective factors earlier. And so those protective factors can really make a difference in getting someone into treatment, showing that you care, showing that connection both at school, with the family, and the community can all impact individuals in a positive way so that they will get help and seek treatment. And a good example of this with youth is when a teacher asks, how can I be helpful? That can be a really powerful question and shows a sense of connectedness to that student. And Mental Health First Aid can educate teachers and others who work with youth to notice these things earlier and train them how to be more confident in talking about substance use, suicide, and mental health issues. And that really is what we're here for with Mental Health First Aid, is to really get comfortable talking about these things and being confident in knowing how to support someone in a crisis. All right, so let's talk a little bit about reducing stigma. So can someone tell me what I mean by person-first language? What do we mean by person-first language? And we hear this in substance use as well, not just mental health first aid. Right. Violetta's typing. Awesome. Person-first language. I'll give you guys a few seconds to type that out. I know it sometimes takes a while for it to pop up. Violetta says person-centered, so we focus on them. That's part of it, yes. Shelly is still typing. Thank you guys for sharing. Colton's typing as well. And it does really focus on the person. It's about making sure that we are not being stigmatizing with our language. So Shelley says, language that focuses on the person rather than the mental health issue. Very good, very good. Exactly. So an example of this, I'll just give you guys an example, would be instead of saying someone is schizophrenic, we would say they are suffering from, or they are experiencing schizophrenic symptoms, things like that. So taking the person out of it, not labeling them. And to make it more like someone, that has a physical illness. So we might say someone experiencing symptoms of heart disease. And so in mental health, we want to use the same approach because that's how we promote reducing stigma, is to help everyone realize and create awareness around that physical and mental health disorders are both you can experience disability from both of those. And so it's important to make that connection, just like we make the connection between mental health first aid and physical first aid. Great. And so Michelle also said recognize the person first, diagnose the second. Very good, very good. Another way we reduce stigma in the curriculum is we use data to debunk myths. And so throughout the curriculum, you'll see statistics that are presented to help debunk myths. And one of those Wanda mentioned earlier was talking about violence and people suffering with mental health issues. Sometimes there's a stigma that people suffering with mental health issues are violent. And so some data is presented that debunks that myth during the curriculum. And then we also do a lot of activities that increase empathy. So one of the activities that is really salient in my mind is when we are practicing experiencing what someone experiencing auditory hallucinations might feel like as someone is trying to ask them questions, and people are in the groups are whispering in your ear, saying things over and over as you're trying to answer questions to sort of create some empathy around that situation and how that person must feel and how difficult it is for them to answer basic questions as someone's whispering in their ear. So that's an example of an activity that is designed around increasing empathy. All right. So now I'm going to turn it over to Wanda, who's going to talk to you about trauma-informed prevention in mental health first aid.
Okay, so I want to take us back to something that Nicole talked about here, risk and protective factors, and remind you about things that increase risk. And as we go to this next section, so mental health first aid helps us to think about trauma-informed prevention. And this is some things as preventionists that we're starting to learn more about through ACE's work, but that someone who hasn't experienced a trauma may be at a higher risk for experiencing some of these mental health disorders and symptoms that we've talked about. So what mental health first aid does is focus on reducing that risk and helping you to address re-traumatizing someone. It helps to address responding to the impact that that trauma has had on the individual, facilitating healing, again, providing those resources and encouraging help and treatment, and actively resisting re-traumatizing someone. So we use such language as what happened to you instead of what's wrong. So again, reducing that stigma that something is wrong with them. What would make you feel better or safer? So we're thinking about the individual and what will help them. I think that, one of the things that I really learned about when I attended the veterans and the EMS and fire training is that there is definitely a culture within each one of those areas of work where they have experienced traumatic situations, and so you want to deal with those as a practitioner in a different way. You certainly don't want to go in and pretend like you have any idea what they're experiencing or going through if you have never gone through that experience yourself. There are some really great materials. We'll show you that website in just a minute. On the Mental Health First Aid website for fire and EMS and for veterans, there are lots of different articles there that talk about it. One of the things you don't want to do is ask someone working in fire and EMS or a veteran, a military veteran, what are some of the worst experiences they've had or some of the worst things they've seen, because you can, activate some of that trauma that they're experiencing. In Mental Health First Aid, an example of that is there is a video where a neighbor is experiencing psychosis, and there are examples of do's and don'ts. So you'll kind of dissect this video, and there are certain individuals who did the right thing and who did not do the right thing, and you can kind of see how that triggered that individual in those different situations. So you'll learn about that in a mental health first aid class, and learn how trauma affects everyone differently. So there's no one-size-fits-all approach. And the most important thing is to come across as understanding and that you care. Again, going back to some of those things that we learned earlier. So this, as preventionists, to us, we can relate this back to cultural competency. Again, and just thinking about these different cultures, and also just individuals that have experienced trauma and how that affects their risk. So back to our roadmap. So we talked about the connection to prevention and the overview. And now we are going to talk about how we can implement this in our communities and how we can take action. And you may be thinking of some of those things already, how that might apply to you and what you can do within your community. We're going to do an activity to wake you up. We've been talking here for quite a while. So Elizabeth's going to take us to an activity. And the first question that we have for you is, how does mental health first aid, how will that be beneficial in your coalition, your organization, or your community, either your professional or personal life? Try to identify a benefit that starts with each letter of algae. If not, you can put it in the anything else box. So again, that question is, how are you seeing now that mental health first aid will be beneficial to either your coalition, your organization, or your community, either professionally or personally? And I think Nicole has some examples for us. And if you can't think of something for every box, that's okay. Just, type something in the E if you want. Or it looks like a lot of people are typing in A.
Yeah.
Fine.
Yeah, and so you could just take an example, like for L, you just start your statement off with, so mine would be letting people know they have a connection to their community. Kind of like doing a crossword puzzle, isn't it? So
yeah,
you guys are doing great, though.
Oh, we've got some great ones for A, accepting people where they are. I love that, Dawn. Thank you. Colton, advocacy against stigma. I love that, too. That is so great. Thanks for adding that clarification against stigma. Identifying those at risk, those that will help bring awareness that our youth in our community struggles with mental health issues. Yes, it's very helpful. Awareness, advocacy. Tanya, I think, that goes along with awareness also.
Yeah. You guys are doing great with this.
I'll let you do L, Nicole.
Sure. So Jamie said linking community members to resources. Very good. Listening to someone while giving them your full attention. Back to our LG action plan, definitely listening non-judgmentally and giving them your full attention. Great. Promote rapport by actively listening. Very good. Listening to those in the community. Active listening. Helping train my coalition partners, including school faculty, to practice active listening. Yeah, the active listening is really important. linguistic understanding, understanding language and culture. That is awesome, Dawn. I am impressed. Very good.
Linguistic.
Yes, understanding the language and culture. Very good.
You guys are doing a good job filling these in.
Yeah, very creative answers.
I'll take G, garnering support. Offer as many options as possible. Yes. Giving data to support issues. Yeah, so I think maybe what you're saying there is helping to provide more resources and data to support the advocacy in each one of those areas. You can talk more about that if you want. Giving assurance, help strengthen my coalition, school faculty to make our students comfortable, including parents. And I don't know what that means to you, Tanya, but one way is just, making sure, getting everyone trained in mental health first aid. I think, that's a great first start to strengthening the coalition.
Great.
You want to do the next E, Nicole?
Sure. I'll do the second E.
Okay.
So Colton said empathy. Very good. That's a theme definitely throughout the curriculum is showing empathy. Engaging in creative problem solving. Jamie. And that's often something that we have to do as preventionists, and so we can apply that to mental health first aid as well. Anyone can be supportive. Very good. Empathetic listening. Very good. And providing a safe space or environment. Yeah, that safe space is really important. And you'll often hear one of the first steps is, in most of the situations in dealing with a crisis, is to get someone to a safe space or a place where they feel comfortable before you start talking to them. And then I also said getting everyone to recognize signs and symptoms. So the more we train our communities, the more we can raise awareness, as you all said, around a letter A, and providing education so that more in the community understand and have empathy for those suffering with mental health or substance use issues. And then Tanya said getting everyone on the same page to help destigmatize the mental health by also utilizing what we already have. Great. Using those resources, right? In prevention, that's what we know. We know how to use those resources and increase those partnerships and use what we have. So you apply those same principles to mental health first aid. All right. It looks like Tony is still typing as well.
I like what we have over here in the anything else, too. We've got some other encouraging. Everyone has mental health first aid. So, yeah, encouraging it's nothing just to have that mental health first aid, just to go and attend that 8-hour course and just have that knowledge, because it is so helpful. And you'll use it over and over again. The first week, I was amazed at, how many situations that I came across immediately that I used it, that I used that training. So that was kind of surprising to me. Health esteem. So, Dawn, I would like you to say more about that. I think I know what you mean, but I'm not sure. I'd like you to explain that a little bit more. Emphasize the importance of mental health training at every school. Some of you are talking about the school environment, and it sounds like several of you work in that environment, and definitely we can be such a support in that area. Substance use and mental health can sometimes go hand in hand. Yes. Those are those shared risk and protective factors that Nicole was talking about. So, Lori, you can't hear. Nicole, can you hear me?
Yeah, I can hear you fine.
Oh, okay. All right.
Make sure your computer's, if you're listening through your computer, that it's turned up. That may be an issue. I'm not sure. And Lori did say always be respectful to culture, and that's another important protective factor, is also making sure people can feel connected to their culture and cultural identity. So.
And I think there are so many of us who would never intentionally, want to cause more harm in that type of situation. But getting more information about those cultures sure helps us to deliver services in a more respectful way. So
That kind of really points to the modules, Wanda, with the fire and EMS and the veterans modules, learning some of those things to be more respectful with military and EMS cultures.
I think we didn't do the first E. So there were a lot of those are around encouragement, again, bringing the mental health first aid to the community. Dawn, in anything else, says part of our wellness plan includes strategies for promoting self-esteem. A component is looking at your health numbers, BP, cholesterol, health. That's great. So encouraging wellness.
Great.
Yeah. Thank you all for participating in that. We're going to do a similar activity, and Nicole's going to tell you about that. So we'll go to, here we go, blank slate.
Yeah, so it's similar procedure, but the question is different. So here we're going to talk about what are some steps you will take in the next 30 days to introduce the idea of mental health first aid to your coalition, your organization, or your community. And you just have to try to identify an action that starts with each of those letters. But as we did earlier, if that's kind of complicated, you can always put it in the anything else box. So something you could do is, for G, let's say, get a mental health first aid course, right? We can take the course. And we will talk to you a little bit about that here in the next few minutes, about how to do that. Any other things you would like to take action on, starting with each of those letters? You can just put them in the boxes.
So what I want to say here is that, we've already talked about this. This could be very similar to what we already did before, when we, talked about the benefits. But, now think about not just something that you can do to fill in the slot, but what is something you really want to do and could do within the next 30 days? What are some doable steps for you? I like that, Tanya, what you put in there for A, assessing previous data that shows the correlation between mental health and substance use for prevention. And you'll see in the mental health first aid class, in that section on substance abuse, you'll see that correlation very clearly.
Right, and Colton said assess the need for mental health first aid and who could benefit.
Right, so lots of assessing going on. We know those spiff steps.
Right, we don't want to deliver a course unless we have the need for it.
Right.
Very good, Colton.
Need to assess for it.
Michelle says practice the training and encourage others by example. Very good. Yeah, sometimes it takes one person in a community to take the training and show how it benefits, and then others will follow. And Dawn also says assess community interest. Great. So it's funny when you guys actually take the in-person course, you'll do a lot of fun things with the algae letters. This was the most interactive thing we could think of online. But when you're in the course, you'll get up and you'll like make shapes with your body that look like the letters, and you'll do all sorts of fun things. So this was our algae activity that we could do online. So thanks for being good sports. So under the letter L, Colton said link with other mental health professionals. Very good. And then John said list appropriate resources for dissemination. And that is a big piece. When you do this course in your local area, you're going to want to have a local list of resources that are available to people. And so that's one thing. If you become an instructor, that you'll want to learn to do is put together that local list of resources when you're doing a training in a certain location.
Absolutely. It's a big task, but it's worth it.
Yes, definitely.
Some of you may have done that already in your communities and have access to a lot of those things. Did you cover G yet?
I don't think we have.
Okay, I'll take that
one.
So get a mental health first aid course. That's the thing we've been encouraging. And, you know, this is sort of our mental health first aid promotion webinar. We really just want to promote that and make sure that that's, you know, going out to the communities, including mental health first aid for youth. I think that's a great thing that we can do. Get more stakeholders involved with mental health first aid. Yeah. I mean, so maybe we can just start to identify who are those stakeholders that would be great advocates for mental health first aid. Part of our assessment and capacity building around this intervention. And I'll take the next E, give Nicole a little bit of break. Violetta says, encourage preventionists to practice. I was trying to say two words at once, it sounds like. Practice active listening and utilize mental health first aid training when engaging with youth and parents. Boy, this can really help our even when we're just working doing our prevention programming, we can definitely learn a lot about our language and using that person first language, and we can do a lot to help begin to reduce the stigma in our communities just by doing that small thing. Tanya says, collaborating with professionals in behavioral health and encouraging others to join the conversation. Again, bringing others in, I think that's an important part of this. Don't do it alone. Encourage people to take part in mental health first aid trainings. Yes.
Great. And I can take the next E, Wanda.
Okay.
All right. So Tony says, once I find out when the trainings are available, and we will show you that, provide a link on our state website. Very good.
Awesome. Thanks, Tony.
Lori says, encourage the school staff to get training in mental health first aid and provide guidance. Awesome. Yeah, getting this out to the schools is really important. There's actually a pilot program out right now as well for teens, teen mental health first aid, to train teens on how to be supportive to each other as well. So it's really expanding, and I think it's great to create that awareness and support. And then under anything else, Shelley says, share information with existing coalitions working with populations that have experienced different types of trauma. Awesome. Yeah, that's probably going to be interwoven into the new round of the curriculum coming up, and so it's going to be great to have that. We touch on it a little bit right now, but it's going to be more woven into the curriculum in the future. All right. Well, I appreciate you guys answering all those questions and entertaining us with that activity. So we're now going to move on to talking about just kind of reviewing those benefits of mental health first aid. Let me get to our slide here. Got off a little bit. So the benefits of mental health first aid. With our coalitions, we have the power to influence social connectedness. And as preventionists, you guys have a long history of utilizing coalitions as sort of your superpowers, and they have strong networks and supports that can be really beneficial to mental health first aid. You can utilize mental health first aid to fill in those gaps of behavioral health, especially in rural areas where it may take longer for 911 to respond or people have limited access to behavioral health clinicians. And then with your coalitions, you also have strength in volunteers and resources in the community to reduce stigma and connect people to services. So those are some things, in addition to those you see on your screen, which of course are very important: preserving life, reducing stigma, individuals who don't have a background in behavioral health can still help, and really promoting and enhancing recovery, which you'll see is a common theme throughout mental health first aid, that people can and do recover.
Yes.
So now I'm going to let Wanda talk about how we can bring mental health first aid to you.
Well, here it is. Oh, nope, not yet. Here we go. Okay, I'll click it. There we go. So bringing mental health first aid to you. Here is the website. This is a live link, so you can go there now if you'd like. Once you get in there, you'll see that there is an area for mental health first aid training, and you can go to the location, type in your city and state, and you'll see a list of available training. A couple of things for you to be aware of is, one thing, you'll see who the trainer is. So if you have a preference for trainers, you'll be able to see what trainings they are offering. The next thing you'll see is that, and I can show you using the arrow here on this, you'll see either a red dot or a green dot, and that indicates whether it's an adult mental health first aid training or a youth. So make sure that you're signing up for the one that you are interested in. And then it'll give you a little bit more information, like the location, the dates, and then you will click on register, and you will be able to be registered for that training. Some other information that you may or may not be important to you is whether there is a cost for the training. Some do charge and some do not. There is a cost associated with giving the training, which is the participant manual, and maybe some other costs. So make sure that you pay attention to that if that is a deal for you. And it is an 8-hour training. Sometimes those are broken up into 2 days, a morning and an afternoon or something like that, or 2 afternoons. So be aware of that and look for that as well. So there you go. Share that on your website. Share that everywhere you can, and get the word out. The more people we have trained, the more we can do to begin to help our communities. And so additional prevention training. Earlier we shared the PPTC Network website, and we're going to navigate there really quick and show you what that looks like. Some of you may or may not have been there yet. And this is what that looks like. This is the main page. This is the main PPTC website page. And if you hover over your PPTC, as you can see, my PPTC is South-Southwest. I also work with Mid-America. But if you click on Not Your Center down here on the bottom, or find the location nearest you, you can click there, and you'll be given a list of the different PPTCs. So if you're joining us today from a different region, you can go to any one of those PPTCs. And I saw a question come in just as I was talking about that. there is generally not a fee for training. Some of the online training, you might see that there is a fee. So the other thing that's really neat and unique about the PTTC than in the past is that you can sign up for training in any region. So if you go here to education and you look at training and events, you can see everything that is available across the network, and it's a lot. And you can do a keyword search if you're looking for specific things and see everything that is available and register for it. So that's pretty cool. And the other thing I wanted to point out to you is the online training. Now we have the SAPS online training now available. So if you have not taken that online training and you maybe you are going to take a SAPS face-to-face in the next 6 months, we recommend that you get on Healthy Knowledge, and I'm going to show you how to do that. Get on healthyknowledge.org and sign up for that training. So here we go. We're going to, from the PTTC website, you can also access it directly, and that link is in our PowerPoint slides today, which will be sent to you later. But you can also navigate there from going to Education, Healthy Knowledge, and there we are. You're going to log in. And so if you do not have an account already in Healthy Knowledge, you'll have to set up an account. It's just a few short questions. And then once you get in, then you'll be able to see that course that's available, the SAPS online course. And you'll type in the code. I'm going to stop sharing my screen. Can you all still hear me?
Yes.
Okay, I just wanted to make sure. I was getting a weird message. Okay, and I'm going to type this in. This is the code. It's PTTC-6, and that is for you to take the online SAPS. If you are with a state agency, feel free to share this with your communities. And this is for the online SAPS. So when you go to Healthy Knowledge, I'm just going to repeat it one more time. You go to Healthy Knowledge, you set up an account, you'll see that SAPS online training course. Click on it, and it'll ask you for a code, and you'll put in PTTC/6 if you are in the PTT6 region. If you are in a different region, send Nicole or I an email, and we will send you the code for your region. Did we have some questions?
I think Dawn had a few questions.
Okay, let's go through some of these questions. Will the PTTC be hosting a TOT? Is that a SAPS TOT, Dawn? I'm assuming. Mental health first aid. Yes. So we do have a youth a youth mental health first aid TOT coming up in July. Give Nicole or I a call about that, and let's see if we can get you into that. And we did, yes. Nicole mentioned in here. So we did a shift on you from Mental Health First Aid. So just to make sure that we're clear, this is the link for Mental Health First Aid. And what I just showed you in Healthy Knowledge is for the SAPS online course. We wanted to promote that because that is newly available, and we know a lot of people have been waiting for that. So So definitely, these are the links for those if you are interested in the SAPS online course. If you have new people that have just gotten on board, this is, you can set. There are no restrictions. Just anybody can get on there and sign up. We encourage you to do that. All right. this is our email address. If you all have any questions, feel free to, if you have any questions about Mental Health First Aid, about SAPS, about the PTTC, anything, also definitely type your questions in there. Now, very important, Nicole is going to talk to us about the evaluation, and then we're going to wrap up for the day. So,
great. Thank you, Wanda. Yes. So we appreciate you guys attending the webinar today. A very important step for you all to take to help us is to go ahead and complete the evaluation using that link right there. You can also scan that QR code with your phone if that's more convenient. And we want to continue to bring you guys these events. Our funding comes from SAMHSA, which requires us to evaluate our services, and we are required to get an 80% follow-up rate. And so it's really important that you help us out by completing an evaluation. Pretty please. And we want you to know that currently the surveys are written for substance abuse treatment and the PPTC Network. We don't want that to confuse you, so just replace treatment with prevention where you see that on the survey, as well as replace ATTC with the PTTC Network as you're completing that. You can click on that link on the slide to go to the evaluation, and we also will pull up the evaluation link when we close out of today's webinar, so you'll have those two opportunities. If you run into any problems with the evaluation, please go ahead and email me at nicoled@ou.edu, and I'll put that right here in our chat, and I would be glad to help you out.